Top 7 Foods That Help with Prostatitis. Welcome to our video. Today, we're going to look at the top 7 foods that can help with prostatitis, including their benefits, how they work, and recommendations on how to include them in your diet. So let's get started. Prostatitis is an inflammation of the prostate gland that affects men of all ages. Unlike benign prostatic hyperplasia, BPH, prostatitis can be caused by a bacterial infection or chronic non-infectious inflammation. The prostate is located just below the bladder and surrounds the urethra, so when it becomes inflamed, it can cause symptoms such as pain and burning during urination, frequent urges to urinate, especially at night, pain in the perineum, lower abdomen or lower back, painful ejaculation, general weakness and fatigue. While prostatitis requires medical attention and treatment, the right diet can significantly support prostate health and reduce inflammation. Let's take a look at the top 7 foods that can help with prostatitis. A quick reminder, this video is for educational purposes only, so please consult your doctor for any medical concerns. 1. Tomatoes. Tomatoes are one of the most well-researched foods when it comes to prostate health. Their key benefit comes from lycopene, a powerful antioxidant that gives tomatoes their red color. Here's how tomatoes can help with prostatitis. Lycopene neutralizes free radicals that cause oxidative stress and damage prostate cells. By reducing oxidative stress, tomatoes help decrease inflammation in the gland and relieve prostatitis symptoms. In addition, several studies have shown that men with high lycopene intake had a significantly lower risk of developing prostate cancer. In one study, men who consumed tomato products more than twice a week had a 35% lower risk of prostate cancer compared to those who rarely ate them. One important thing to know, lycopene is better absorbed from cooked tomatoes than from fresh ones. Tomato paste, tomato sauce, and canned tomatoes contain lycopene in a more bioavailable form. Adding a small amount of olive oil further improves absorption, since lycopene is a fat-soluble compound. Recommendation: include tomato products in your diet 3 to 5 times per week. 2. Fatty fish, salmon, mackerel, sardines. Fatty fish is one of the best natural sources of omega-3 fatty acids, which play a key role in fighting inflammation. Omega-3 fatty acids, EPA and DHA, directly suppress inflammatory processes in the body, since inflammation is the primary mechanism causing pain and discomfort in prostatitis. Regularly eating fatty fish can significantly relieve symptoms. A study published in Clinical Cancer Research found that men diagnosed with prostate cancer who followed a diet high in omega-3 fatty acids had significantly slower disease progression. Other studies confirm that omega-3s reduce levels of inflammatory markers, particularly prostaglandins, which are directly linked to pain and prostatitis. Beyond their anti-inflammatory effects, omega-3 fatty acids also improve blood flow to prostate tissue, which supports its recovery. Recommendation: eat fatty fish 2 to 3 times per week. If fish isn't part of your diet, consider fish oil supplements, 1,000 to 2,000 milligrams of EPA and DHA per day. 3. Pumpkin seeds. Pumpkin seeds are a true superfood for the prostate, widely used in traditional medicine for centuries. Today, science is increasingly confirming their effectiveness. Pumpkin seeds are rich in zinc, a mineral that is critically important for prostate health. As research has shown, men with prostatitis and BPH often have reduced zinc levels in prostate tissue. Just one handful of pumpkin seeds, about 30 grams, covers approximately 20% of your daily zinc requirement. In addition to zinc, pumpkin seeds contain phytosterols, plant compounds that help inhibit the conversion of testosterone into dihydrotestosterone, or DHT. DHT is one of the key factors that stimulates prostate growth and inflammation. In a double-blind study, men with prostatitis symptoms who took pumpkin seed oil for 12 weeks reported significantly reduced pain symptoms and improved urinary function compared to the placebo group. Recommendation: eat a small handful of raw or lightly toasted pumpkin seeds every day. You can add them to salads, oatmeal, or yogurt. If you're finding this information helpful, please hit the like button, subscribe, and turn on notifications so you never miss our new videos on health and nutrition. 4. Green tea. Green tea has been used in traditional Asian medicine for thousands of years, and modern research is increasingly confirming its benefits for the prostate. The main active compounds in green tea are catechins, especially EGCG, epigallocatechin gallate, These are powerful antioxidants that neutralize free radicals and directly reduce inflammation in prostate tissue. A study published in Cancer Epidemiology, Biomarkers and Prevention found that men who drank 5 or more cups of green tea per day had a significantly lower risk of developing prostate cancer compared to those who drank less than 1 cup. Furthermore, EGCG has demonstrated the ability to inhibit the growth of abnormal prostate cells and stimulate their apoptosis, meaning their programmed cell death. Green tea also has antibacterial properties, which can be especially beneficial in cases of bacterial prostatitis. Recommendation: drink 2 to 4 cups of green tea per day. Avoid adding large amounts of sugar, as this reduces the anti-inflammatory effect. 5. Broccoli and cruciferous vegetables. Broccoli, cauliflower, Brussels sprouts, and other cruciferous vegetables are among the most beneficial foods for men's health. The key active compound in broccoli is sulforaphane. This substance has a pronounced anti-inflammatory effect and, according to research, is capable of suppressing the growth of prostate cells associated with inflammation. In addition, sulforaphane activates detoxification enzymes in the body that help eliminate toxins contributing to inflammation. In a study published in PLOS One, men with prostate cancer who consume broccoli 4 times a week showed significant changes in genes related to prostate cancer progression compared to the control group. One important tip: to preserve the maximum amount of sulforaphane, it is recommended to lightly stir-fry or steam broccoli without overcooking it. Raw broccoli is also an excellent option. Recommendation: include cruciferous vegetables in your diet at least 3 to 4 times per week. 6. Pomegranate. Pomegranate is rightfully called the king of antioxidants. In terms of antioxidant content, it surpasses both red wine and green tea. Pomegranate is rich in polyphenols, punicalagins, and ellagic acid, which have powerful anti-inflammatory and antioxidant properties. These compounds help reduce levels of inflammatory markers in prostate tissue and decrease oxidative stress. A clinical study published in the journal Prostate found that men with recurrent prostate cancer who consumed 240 milliliters of pomegranate juice daily had a significantly slower rise in PSA levels, a marker of disease activity, compared to the control group. Other studies confirmed that pomegranate extract inhibits prostate cell proliferation and stimulates their apoptosis. In addition, pomegranate improves circulation in the pelvic area, which helps reduce swelling and pain associated with prostatitis. Recommendation: drink 200 to 250 milliliters of natural pomegranate juice daily, or add pomegranate seeds to salads and oatmeal. 7. Turmeric is a spice that has been used in Ayurvedic medicine for thousands of years, and is today one of the most well-researched natural anti-inflammatory agents. The active compound in turmeric is curcumin, one of the most potent natural inflammation inhibitors known to science. It blocks molecular inflammatory pathways, specifically suppressing the activity of NF-κB, one of the main switches of inflammatory reactions in the body. Studies have shown that curcumin can reduce levels of inflammatory cytokines in prostate tissue, decrease pain symptoms in chronic prostatitis, and slow the growth of abnormal cells. In one clinical study, men with chronic prostatitis who took curcumin combined with quercetin for 1 month reported significant pain reduction and improved quality of life compared to the placebo group. One important note: curcumin is poorly absorbed on its own. To improve bioavailability, it is recommended to consume turmeric together with black pepper. Piperine, the active compound in black pepper, increases curcumin absorption by up to 2,000%. Recommendation: add turmeric to your meals daily, or take curcumin supplements, 500 to 1,000 milligrams per day, combined with piperine. Thank you for watching our video on the top 7 foods for prostatitis. We hope the information was helpful and easy to understand. While prostatitis requires medical treatment, the right diet can be a powerful ally in fighting inflammation and painful symptoms. Including tomatoes, fatty fish, pumpkin seeds, green tea, broccoli, pomegranate, and turmeric in your diet can support prostate health, reduce inflammation, and improve your overall quality of life. Also remember the importance of regular physical activity, staying properly hydrated, and avoiding foods that irritate the prostate, such as spicy foods, alcohol, and caffeine. Thank you again for watching. We hope this information helps you on your journey to a healthy prostate.